Two words about Norman Sartorius. As most of you know, is a Croatian psychiatrist and a university professor. Sartorius is a former director of the World Health Organization's Division of Mental Health and a former president of the World Psychiatric Association. He has been described as one of the most prominent and influential psychiatrists of his generation. Sartorius was born in Munster and grew up in Zagreb. He finished his specialization in psychiatry and neurology in 1963 and defended his PhD thesis in psychology at the School of Medicine, University of Zagreb. After obtaining his PhD, Sartorius spent some time at the University of London. He was appointed director of the Division of Mental Health of WHO, a position which he held until 1993. He served as the president of the World Psychiatric Association 1993-1999 and the Association of European Psychiatrists. Sartorius became a full professor at the University of Geneva in 1993. Also held a full professorship at the University of Zagreb and the University of Prague. He retired as a full professor in Geneva and Prague in 2001. He has worked as visiting professor in very many universities. He is also an honorary fellow of the American Psychiatric Association, the Royal College of Psychiatrists in the UK, and the Royal Australian and New Zealand College of Psychiatrists, and the corresponding member of the Royal Medical Academy of Spain and the Croatian Academy of Science and Arts. Sartorius' work dealt with epidemiology in social psychiatry, schizophrenia, depression, and health service delivery. Major themes in his work and public activity are rights of mental patients, struggle against stigma and prejudices associated with mental illness, and improvement of mental health services. Between 1961 and 2014, Sartorius published more than 350 scientific work. According to the Web of Science, Sartorius' articles have been cited more than 6,800 times. He has authored and co-authored over 66 books. So we have the pleasure to connect with him. Norman, can you hear us?
Yes, I hear you well. Can you hear me? Can you hear me? Hello?
Hello, Norman.
Yes, can you hear me?
Yes, hi, Norman. I am Ernesto. Welcome to the meeting.
Thank you very much.
I know that you were unable to join us today in Modena, but I know that you are now able to speak and to present your expertise and your science to us.
Thank you very much. Thank you very much for your understanding as well. I do apologize for not being with you in person. I would have liked to come back to Modena, where I have only the most pleasant experiences and memories. I hope there will be another occasion. Professor Caffo and others have invited me to speak about the mental health of the world's children. And of course, I'm not a child psychiatrist, so what I'm going to say is a view, what one would call a public health view of the problems of children in our age. And please turn to the first slide. As you will see from the slide, I plan to present Is it okay? Can you hear me still?
Yes.
Still hear me?
Yes.
Yeah. I plan to speak firstly about the definitions of childhood and adolescence, and then proceed with some of the facts that influence the growth and the development of children, the context in which children are living today, what good things, what assets are available to them, and what the challenges are to the promotion of child mental health in this time, as well as then end up with some perspectives which I think will be relevant. And now I'll turn to slide number 3 on the definitions of childhood and adolescence. It is easy to believe that the childhood and adolescence is well defined everywhere, but that is unfortunately not true, which makes the planning or recommendations that one would do for the world extremely difficult. Chronological age, the biological age, and the social age of children are not parallel in all countries. In fact, they are very different. In India, for example, nearly 1/2 of the girls of the age of 12 or 13 are married already. And in China, the average age of marriage is moved up to 30 to 35. When you look at the child soldiers who have in fact carried the wars of Africa, the majority of them were at the age of approximately 12, 13, or 14. These children of 12 armed with guns are very different people from children in school in Middle Europe. Even the biological age varies between different parts of the world. Menarche, for example, in Europe, much later than in some other countries, and they will descend to the age of 9 or 10 in some of the countries, while in other countries they will be as late as 19, 17, 18, or 19. So the biological change is biological age, chronological age, as well as social age of children are extremely difficult, and that makes a difference, and that makes our planning for global programs very difficult. I turn to my next slide now, still continuing the definitions. And I would like to make a special comment about the word adolescence, because it's a recent invention. Teenagers never existed in previous times. Akbar the Magnificent, a great ruler, was in fact assuming the position of king in the Mongols when he was 13, and he was winning battles. Other children of 13, 14, 16 have been taking full care of their families. It is relatively recent that it has been possible to introduce this curious period of latency in which children are in fact just past puberty, and now for 4, 5, or 6 years live in a society without being responsible and without having any specific social duties. They are behaving in ways that correspond to creatures that have no duties and no responsibilities. And I think that we have great difficulties to find ways, particularly in countries in which the concept of adolescence is introduced recently, to know exactly how to handle that group. This group is void of stimulation of the right kind. They are without challenges which this age would very often want, and they are very currently, this period of adolescence is producing for us a number of difficulties which we are not yet quite sure how to handle. Another problem of the definition is that the legal responsibility, as well as other social responsibilities of children and adolescents, as well as family members, vary between cultures. The notion that a child can have rights is a relatively new invention, and it's recognized in some countries, while in other countries it is not recognized. Not only that it's not recognized as a right, but even the very existence, for example, of female children is not being recognized as being important. You will find countries in which will, when they are asked how many children they have 3. And then you ask them another question, and how many girls? Says, yes, 3 more. Because somehow it's only the boys who count, and it's the boys who in fact make all the difference in the numbers of children and the ways in which this is done. The sad consequence of that at the early age is what is called the biological shortcoming of women, because a large number of women in the ages and they are fertile will in fact have female children, but these will be eliminated in the most cruel of ways. There is what is called the deficit of women, deficit of children of female sex, which is spreading somewhere from Egypt and Lebanon all the way through to China. And there are what is called the 10 million missing children per year, because the women, the children who are of the female sex, are very often either eliminated before birth or after birth, because they represent, in those countries, a major economic obligation at a later age. So all of these are just examples of the difficulties of understanding the social age and the relative importance of children at that time. I'll now move to the next of my points, which is the context of growing up. And I think that now switch to the new slides, please, the context of growing up. The first item that you see on this word, which is called the word decivilization. Now, this is a word which really describes a curious and sad phenomenon that has recently become apparent in many countries. A civilization can be measured by the amount of attention and care that it gives to its feeble members. Societies that provide care to such feeble members, the children, the elderly, the invalids, etc., can be called civilized, while others which do not do it really cannot be grouped with the first or with these countries. And what we are seeing, sadly, is that the current years have brought with us a period of decivilization. That is, that the attention to the feeble members of societies, instead of increasing, is in fact decreasing. That is demonstrated by the increased rate of child mortality, which has grown again in Eastern Europe, for example, and in some other parts of the world, with the increased mortality of people with physical disabilities and the high rate of depression, of one would call reactive depression in the elderly, who have been deprived of many of the things that they expected as being received as care at an earlier age. Now, this decivilization, which affects children, of course, affects also their health care. Another phenomenon of the context of growing up is what is called commodification. This is a terrible word. It's a long word which has been introduced by the World Bank in the first instance. And it basically says that everything, if societies are to progress, says the bank, everything has to be treated as if it was a commodity, like sugar, or cotton, or timber, or iron. That is, everything must be given a price, and everything must be purchased or sold. There is no higher ethical imperative. It is only a matter of how much you pay for how much you get. So health has been included in this as well. So while previously doctors' duty, society's duty was to improve health, today it will improve health if this is also bringing a certain economic benefit. And if when it comes to the evaluation of services, the first thing that is evaluated in services is, are they in fact economically productive or not? Doctors who are directing hospitals are asked, is your hospital making money? As if this was a money-making machine rather than a place in which a society has decided to offer help to those who are not. Some of the other things that are also relatively recent has been the revolution of informatics. The fact that the whole world, all of its miseries are brought to you every morning on your internet. The fact that the whole structure of information in societies has moved from a personal contact into an impersonal contact. The informatics have brought an enormous number of things. And what is also important is that while we were previously thinking that the advent of informatics decrease the difference between those who are educated and rich and those who are not educated and are not rich, in fact, it has increased it. Because informatics serves primarily people who are better able to use it, who are more knowledgeable, who can learn how to deal with it. They can afford to buy the machines that continue to be produced. The structure of families has been changed in a manner that is substantial. The number of people who live alone has increased. In London, 30% of all households are single-person households. The number of children who are born out of wedlock, which was previously a great shame, etc., in some countries has got 20 times to 30 times greater than it ever was. The notion of the more recent notions of one-sex families and couples and similar forms have all changed the traditional structures of families, which had very often a three-layer family with the grandparents, the parents, and the children, and the three have learned together about ways of living at all of these different ages. The middle class has also changed. It has been significantly compressed by the fact that the number of givings which they have to invent to support the government and the state has grown. So that the middle class is in fact developed countries such as Europe has shrunk, has become less numerous, has become lesser, with the consequence that many of the moral prescriptions which the middle class normally preserves and which the middle class carries with it have in fact stopped being present. And what we notice as being a fall of morality and the fall of the willingness to accept and follow social norms has in fact been very visible in most of the countries of Europe. In the developing countries, the situation is opposite. There the middle class has grown enormously, so that today we have in a country like India more middle class citizens than in the United States of America. There are about 250 million of them, which means that they will attract a variety of enterprises, hospital chains, or other things which are important for a good, strong middle class. And while at the same time, a huge proportion of people remain without any source of income that would allow them to develop properly. So that you get suddenly in a country like India, 800 million people who are very poor and 300 million who are quite well off, and maybe another 50 million who are very well off indeed. This has led to the development of medicine of two speeds, which were the number one class medicine that is available to the middle class and no treatment or no medical help at all for those who are in the poor class. Urbanization is another phenomenon that is present in the context. We see that the urbanization has been extremely rapid. It has grown with tremendous speed in any country. Today, the most urbanized country in the world is Argentina, in which up to 85% of the population now lives in towns. And most of these people have moved to towns in the last 10 to 15 years. This means that the population that lives in town is continuously changing and that the traditional notion of a community is just nonsense in the urban settings of most countries in the world. Now, recently, Richard Horton in the Lancet wrote about the fact that the world organizations, the World Health Organization, the United Nations, and many other governments and so forth, seem to be behaving as if they were in the echo chamber. That is, they say something and then the others echo, say, nations say yes, important. Governments say yes, it's important. And so the echo goes round, but in fact, it is separated from what Horton the social chaos, which is outside of this echo chain, which is not taken into account. 580 million people in the world are currently in countries in which there is war. There is a huge number of people who have no access whatsoever to healthcare or anything else. These are all not taken into account. Big documents that are produced by the World Health Organization or others, for example, never mention private care or mortality due to violence that is happening in institutions, many other things. It's the social chaos outside, the echo chamber in the middle, in which the governments and intergovernmental organizations of today exchange and talk to one another as if things were happening because of that at the level of the population. I'll change to the slide and continue to the context of growing up, because I think there is also important additional developments. There have been vast advances of knowledge relevant to medicine, not only within medicine, but also relevant to medicine. We have seen that the health system in the world has changed in a manner that is completely different from that which we hope to develop further in the middle of the 20th century. The growth of private industry has been enormous, private health industry, while the national health systems, which have been supported and carried by government, have continuously weakened. Even the most best example of this system that was introduced in the 1950s in Britain is now weakening, and the question is that whether it can survive, or whether in a way it will become indistinguishable from the private health industry. There has been, in the beginning of the 18th, 19th century, a development which said we will do something about preventing disease, and that has grown very beautifully. It has had a particular strength of growth after the Second World War. But now the prevention as a whole is neglected, and the neglect is of an alarming size. We now see that most of the investment that is being put into healthcare is no longer going into prevention. Diseases which are easily reachable by primary prevention. Taking our example in our field, every year about 10 million people are born as cretins because the governments did not think that it's worth their while to invest in providing iodine to mothers women who are in a fertile age. Completely unnecessary, huge number of people who will be handicapped for life because somebody didn't worry about providing a little bit, an ounce of prevention that would help people not to fall sick. I think of the welcome respect for human rights. Human rights have been promoted, and that is extremely positive. But many of the people are now thinking about these human rights, very often see them as somewhat obstacles. For example, in the continuous refusal to accept vaccination for diseases which are close to eradication, but cannot be eradicated as long as there are people who, in fact, will refuse to accept vaccination or will not let their children be vaccinated. Change slide, please. I'm not talking about my third topic, which is the assets of child development. The assets of child development, of course, are many. We have controlled in one way, in many countries, particularly developed countries, many of the children's diseases. There has been an curious phenomenon of this, of course, that the parents very often now have to deal with dominantly healthy children, and they find that these children are far too active. They eat well, have a lot of caloric intake, they have no disease, and they are pumping up and jumping up and down much more than before, which to an extent also opens the door to the diagnosis of hyperkinetic and other children disorder, which in fact is to a large extent a consequence that we have never seen before children in such good health state as we see them today in the developed countries. Another advantage that has been used in many countries is child spacing if possible, and that therefore mothers and families have an opportunity to give appropriate attention to to the children as they grow up, rather than as it was in the past, being unable to control the speed with which children are being added to the family. Children as well as adults have huge access to child new technology. And we have finally arrived at a point where children are recognized as human beings and therefore have certain rights. The number of child health agencies has grown astronomically, and we see a large number of them. They are very often, they could be an asset, but they are not, because they are falling over each other, and they are in fact not coordinating, nor do they want to coordinate their work between governmental organizations such as, for example, UNICEF, and non-governmental organizations. There are just huge numbers of them, very often harking on the same thing, while in fact other areas are left completely blank. I shall proceed to the next slide now, where I shall speak about the challenges to the promotion of child health. The first large challenge that I've listed there is that the family structure has changed. Children no longer learn very well what elderly are, nor are they very easily finding a relation with them. In some countries, of course, this is not so, because grandparents have taken care of children altogether. But that has another consequence, which is that they never learn what their parents are like, because the parents are absent for most of the day. The squeeze of the middle class has made both women and men go out for work, leaving children in the care of either of considerably lower social class and education, or in the care of parents, grandparents, whose knowledge of the world of today is not complete. The change of the social roles of women has been significant. The main aspect that has been an exit of the women from the house and into work. The unfortunate consequence of that is, there are many fortunate consequences, of course, but the unfortunate consequence is that while accepting responsibility outside the house, nobody has really taken responsibility for the previous tasks that the women had, so that they, by and large, now operate under tremendous stress with enormous burden on their shoulders. And one of the consequences of that increased burden is that their capacity and ability to deal with their children's emotional need is decreased. We now know that it's important for a child, if it was to grow up properly, to have a relationship which is of confidence with somebody whom they can approach whenever they need it, not at a given time in the day. The notion of quality time that was introduced some time ago is really nonsense. But that children need somebody whom they can trust at all times. That has become extremely difficult in many situations. Child abuse is being spoken about in many places. I greatly regret, I must say, that many more people speak about it than do anything about it. The echo chamber is in operation here as well. Everybody agrees that it should not be done, but nobody does anything to prevent it. And this child abuse has different forms. In many countries, most of the industry depends on child labor. They're not talking about it too much. In other countries, the fact that children will be married by the age of 10, 12, or 13 and have their first child when they are 14 is not considered in any way as reducing the period of childhood learning. And you could go on for sexual abuse, labor abuse, other types of abuse of children, about which everybody is unhappy that it happens, but in fact, not enough is done to prevent or stop it. We have also seen an another development, which is that the schools have changed their role. As the parents become more busy and give less time, they hope that the schools will take on the role of educating. But the schools